Hello everyone, I'm Dr. Amit Bhushan Sharma, Associate Director, United Cardiology, Paras Hospitals, Gurgaon. Today I'm going to talk to you about cardiac care in winters. As you know, summers is the season for diarrhea and dengue. Winters is the season for cardiac problems. What happens is blood vessels narrow down in winters, so maximum heart attack, heart arrest occur during winters, especially during late nights and early mornings. And this is the point of time when your cardiac arrest or heart attacks occur. Especially people who are diabetic, hypertensive, you should know your numbers. Know your numbers means like you have a bank KYC, same way you should be maintaining your numbers, maintaining your pulse, blood pressure and your fasting blood sugar at least 2 days a week, 3 days a week. You should monitor their numbers and see whether these numbers are going haywire. No problem is built overnight. My message is monitor your numbers and know when there is an aberration and know your trigger points. For everybody, the trigger point may be different. So one fine day, if you find your sugar to be 125, 126, think retrospectively what happened last night. What was it? Whether it was carbs, whether it was alcohol, what was it which caused your sugar to rise? So you should know your trigger point. Same way, if the blood pressure goes very high, whether it was lack of sleep, you have to find out. Whether the pulse was very high, whether it was wine which you took last night. So find out your trigger points and discuss with your physicians, because after the age of 35-40, the game is to know your trigger points, know your numbers and see what your trigger points are. I might tell you eat papaya during if you are a diabetic, but then the lady in front of me might tell me that my sugar gets increased by after eating papaya. So everybody's trigger point and aggravating points are different. You have to know your numbers properly, get a hold of them, know what triggers your aberration, what triggers your increased BP, what triggers your increased sugars, what triggers your abnormalities in pulse, and try to control them. Winters, if you have a cardiac patient at home, he should be wearing double the levels of cardigan or a jacket. If your son is wearing half a jacket, you wear a cardigan to keep your neck covered. Avoid early morning walk, avoid late night walks, go when the sun is out, avoid fasting, avoid feasting, eat by the clock. We eat when we are hungry, but you should be eating every 2-3 hours. Keep yourself well hydrated. So these are small measures which go a long way in protecting preventing and having a cardiac catastrophe in the winters or at night. Thank you.